This is your news source evening bulletin for today, Tuesday, the 16th day of March in the year 2021. I'm Gordon Mosley, thanking you for joining us. Here's what we're tracking tonight. China is making moves to push for more cooperation with Guyana, while lifting the bilateral relations between the two countries to a higher level. That announcement came today from Chinese President Xi Jinping, following a virtual meeting with President Irfan Ali and the senior Guyana government team. Next year, Guyana and China will celebrate 50 years of diplomatic relations. In a statement issued by a Chinese news agency, it was stated that during the meeting, President Xi suggested to President Ali that the two countries earnestly respect and accommodate each other's core interests and major concerns, promote Belt and Road cooperation, and expand win-win collaboration in areas such as energy and infrastructure. Xi said the two countries have had fruitful results in cooperation since the establishment of their diplomatic ties, adding that China-Guyana ties showed great potential as the trading between the two sides increased amid the COVID-19 pandemic. The Chinese president is also quoted as saying that China is willing to strengthen COVID-19 vaccine cooperation with Guyana and will continue to assist Guyana in its fight against the pandemic. President Ali gave his appreciation to China for its assistance to Guyana in the fight against COVID-19, stating that the friendship between Guyana and China is strong and tight, according to the Chinese news agency. In a statement this afternoon, the office of the president only indicated that the meeting took place. Vice President Bharat Jagdeo, Foreign Minister Hugh Todd, Finance Minister Ashni Singh, and Works Minister Juan Edgell sat in on the meeting between the Guyanese and Chinese presidents. The meeting between the two presidents came just 1 month after Guyana was forced to cancel an agreement with Taiwan to establish a trade office here, following the objection of China. China considers Taiwan as a breakaway province, and the move by Guyana to establish ties with Taiwan angered the Chinese government, triggering a reversal of the decision by Guyana to allow a Taiwan trade office here. More news is coming up in just a moment.
Guyana, we've been through it all.
But as a people we have
weathered every storm
and risen to every challenge.
Because it is the people of Guyana
that gives it its strength.
all the people,
regardless of race,
class, or religion.
we are one people, one strength.
And now is our time. A time to rise. Together, we rise.
I'm Dr. Sadhna Samtani, National Supervisor for Region 6 for the Lymphatic Filariasis Campaign 2021. I'm encouraging everyone to take your pills to stop transmission of filaria in Guyana and also to alleviate suffering for those chronic patients. I have taken my pills. I encourage you also to take your pills.
Go spread the word in your area. We gonna end filaria.
For the past 2 decades, the global community prioritized eliminating lymphatic filariasis, commonly known as filaria, as a public health problem. Many countries in the Americas have achieved this goal.
We're looking to have 100% eradication of this disease in Guyana.
So we look forward to all of our citizens working with our teams from the Ministry of Health as they go around in our communities, meeting with you to administer this pills.
And I will encourage you all to take your pills so that we can once and for all rid Guyana of filariasis.
We have to get rid of the negatives in relation to filaria. So please let the science be your guide and take the tablets.
My family would be taking their pills. I do hope that you would also be taking your pills so that we can together work on eliminating filaria from Guyana.
Filaria gonna get knocked out. TKO.
A message from the Ministry of Health in collaboration with PAHO.
We are legions of men standing strong, but never too proud to stoop and help someone. We must send a clear signal to all. Do right. Walk in upright ways, knowing that's what being a man is all about. And ever aware that things will only get worse when good men do nothing. Stand strong. Be the one to live right.
Mom, what are you doing with GPL on your list?
Child, you forgot I have to pay GPL?
You got time with GPL?
I have to keep these lights on. The customers who think in that manner and refuse to honor their obligation to GPL are obviously not playing their part in ensuring quality service delivery. So, I will continue to pay my GPL bill on time, every time.
I recognize the value of your point, Mom. You were right.
Although for most of 2020, Guyana had its borders closed and there was a slowdown in activities across the country as a COVID-19 curfew was instituted, the authorities still found themselves dealing with a large number of trafficking in persons cases. During a training program for members of the police force today on trafficking in persons, it was revealed that the crime remains a troubling one in Guyana. The training program was organized by the Ministry of Human Services. The coordinator of the Counter-Trafficking in Persons Unit, Tanisha Williams-Corbin, told the participants that human trafficking continues to plague the Guyanese society, noting that there were 225 reported cases last year.
In 2020, the Ministry of Human Services Counter-Trafficking in Persons Unit recorded identifying and assisting 225 victims of human trafficking. 225. It may sound like a small number, but if you take into consideration Guyana's population, you can understand why it's very, very, very concerning.
The coordinator also explained that the training program is among a series of initiatives developed by the unit and the ministerial task force to push back on human traffickers and help the victims.
This training course was developed back in 2019 when we realized, or when we saw the need to have a specialized training for traffic crimes. A specialized training for you. Prior to 2019, you were part of just the general anti-trafficking training for members of the Guyana Police Force. And I can tell you this, we saw the need for this because we recognize that the majority of the victims who were seen at the time, they were being transported on our roadways.
Senior Probation Officer Dennis Ralph said the training of police officers is necessary since there have been many instances where the police failed to identify potential victims of human trafficking.
You will be on the road wherever you're stationed, and you will come into contact with potential victims of trafficking. And this course, at the end of this training course, you'll be able to identify suspected victims of trafficking, and in so identifying, you'll be able to refer it to us. So we all in this fight to combat human trafficking.
And the Guyana Police Force's training officer, Superintendent Shiv Prasad Bacchus, said the training will be ongoing since the force will be on the front line in the fight against trafficking in persons across the country.
And this program gonna see that it is a continuum where members of the force, frontline ones, especially you, the traffic ranks, and others who are more engaged in combating traffic in person, and the Guyana Police Force, in collaboration with key stakeholders, are no exception.
Guyana has been performing better in recent years in its fight against trafficking in persons. More victims have been getting the help they need, and more of the perpetrators have been facing the courts. In the area of health, the government of Guyana, with support of the International Atomic Energy Agency, will be moving to develop a cancer control program, Minister of Health Dr. Frank Anthony has announced. The program is expected to be developed within the next couple of months, with a consultant already identified.
Gather a team within the ministry under the chronic disease department of the ministry to look at not just kidney, but almost all the chronic diseases that we have in the country. We are now building out that program. Our anticipation is that we'll also have a plan for the next 5 years in different areas of chronic diseases. And hopefully we'll be able to roll that program out and change the landscape of what is happening with chronic diseases right now in Guyana.
The aim of the program, according to the health minister, is to reduce the rate of cancer in Guyana.
There are a number of subcomponents in that program, which includes the component dealing with the more prevalent cancers. So in men you have prostate cancer, so we want to have a more dedicated focus on prostate cancer. And in women we are looking at breast cancer and cervical cancer. So in each of these areas or diseases, we want to come up with sub-programs that would really address it in more detail, and hopefully we can prevent many of these cancers from occurring.
Additionally, Dr. Anthony said the government is working to ensure that people with end-stage kidney disease can also access more treatment.
Cardiovascular disease is another area that we have a lot of focus on. And this year we will be partnering with PAHO WHO to introduce a program called HEARTS. HEARTS is aimed at reducing some of the risk factors to cardiovascular diseases, and this includes reduction of sugar consumption, trans fat, and all those other risk factors that can help to promote cardiovascular diseases.
A special program will also be developed in the coming months for diabetes and other chronic diseases that continue to affect Guyanese citizens. Well, 4 months after escaping from the Lusignan prison, a 48-year-old murder accused has been recaptured. The prison service and the Guyana Police Force today announced that escapee Philip Jagru was recaptured in the village of Ruby on the west coast of Demerara this morning. The police statement said he was captured by police ranks just around 7 o'clock. He was reportedly spotted by residents after stealing a number of items from a poultry farm. The residents raised an alarm and alerted the police. Jagru was charged for murder back in 2019 after hitting a drunken friend to the head and dumping the man's body in a trench in Leguane. He escaped from the Lusignan jail in November last year. Well, one day after sugar workers at Blairmont and Albion protested for increased salaries, workers attached to the Iflut estates joined the picket line this morning. The Iflut workers are demanding that the sugar corporation Gaisuco ends its procrastination regarding salary discussions between the union and the corporation. The workers have expressed a willingness to find a settlement, but they claim that Gaisuco continues to engage in delaying tactics for unknown reasons. The sugar workers are also accusing the new management of Gaisuco of putting themselves before the industry and the workers, according to the Guyana Agricultural and General Workers Union. In a statement, Gawu said the workers lamented that the Gaisuco hierarchy has taken their cooperative attitude for granted, and they shared that they have learned that while they are asked to be patient, they are learning that some in the top brass of the sugar company may be engaged in self-aggrandizement. The workers pointed out that this does not send a positive message and undermines the calls for cooperation. Like their colleagues at Blairmont and Albion, the sugar workers at Iflut are hopeful that the corporation could resume talks with Gawu to find an amicable solution to the matter as soon as possible. Police investigators have been given additional time by the court to continue to detain the suspect in the murder of the 10-year-old Sophia boy during a robbery. The suspect was first arrested last Friday, and investigators are seeking 2 additional suspects as the probe continues. The 10-year-old boy Anthony Court was at the home of a Sophia businesswoman along with his mother when 2 armed bandits invaded the property and robbed the occupants of their money and jewelry. The young boy was in the upper flat of the building and was shot by one of the bandits as he emerged from a room at the same time as the bandits were going to the upper flat. The 2 armed men ran from the scene and the boy was pronounced dead at the Georgetown Hospital. Family members are hoping for justice as they continue to mourn the death. They have been receiving support from both the government and the opposition. The president and the opposition leader both visited with the boy's parents. As the national COVID-19 vaccination program continues to be rolled out, health officials are becoming increasingly worried about the increasing number of COVID-19 cases in the country. Since the start of March, the Ministry of Health has recorded 612 new cases of coronavirus in Guyana. Based on the statistics being released by the Health Ministry, the country is averaging 50 new cases per day, which is one of the highest infection rates in the Caribbean. The majority of new cases are asymptomatic. Health officials intend to step up the monitoring of those persons restricted to home isolation instead of hospitalization. Many of them have been breaching the stay-at-home order after being tested positive. In the past 24 hours, 51 new cases were recorded, with 7 persons still in the COVID-19 intensive care unit, as another death was recorded. On the recovery side, since the 1st of March, health officials have seen 335 recoveries. The Ministry of Health continues to plead with citizens to follow the COVID-19 guidelines and protect themselves against the virus.
Guyana, we've been through it all.
But as a people, we have
Weathered every storm
and risen to every challenge.
Because it is the people of Guyana
that gives it its strength.
all the people,
regardless of race,
class, or religion.
We are one people, one strength.
And now is our time. A time to rise. Together, we rise.
Fuel it up and drive, super 95. Tune up, fuel it up and drive, super 95. Tune up, protect your fuel system, boy. High mileage and performance, boy.
Guy Oil Super 95 gasoline gives you more reasons to drive and is available at 56 service stations nationwide. For affordable price, high performance, and high mileage, choose Guy Oil's Super 95 gasoline.
Fuel it up and drive. Go spread the word in your area. We gonna end Filaria.
For the past 2 decades, the global community prioritized eliminating lymphatic filariasis, commonly known as filaria, as a public health problem. Many countries in the Americas have achieved this goal.
We're looking to have 100% eradication of this disease in Guyana.
So we look forward to all of our citizens working with our teams, but in the Ministry of Health, as they go around in our communities, meeting with you to administer this pills.
And I will encourage you all to take your pills so that we can once and for all rid Guyana of filariasis.
We have to get rid of the negatives in relation to filaria. So please let the science be your guide and take the tablets.
My family would be taking their pills. I do hope that you would also be taking your pills so that we can together work on eliminating filaria from Guyana.
Filaria gonna get knocked out. TKO.
A message from the Ministry of Health in collaboration with PAHO.
Regional Health Officer for Region 2. I just had my pills. I endorse the filaria elimination campaign. I'm appealing to all Essequibian and the entire Guyana. So take your pills so that we can eliminate filaria in Guyana as a whole. So we're all in it together, and let's work together to eliminate filaria in Guyana.
Due to the impacts of the global pandemic, COVID-19, across our nation, essential organizations like us have chosen to adopt innovative approaches to meet the emerging needs of our customers while protecting our employees. Here are some quick tips to make managing your GPL bill easier while we practice social distancing. To register for electronic billing, you can use the e-billing tab on your website. To access your bill balance, you can use 4 options: the website live chat at gpl.net, the online inquiry on our website under billing, SMS Freedom by texting your GPL reference number to 624-0400 or 608-8400, or call our call center at 226-2600. A message from the Guyana Power and Light Incorporated.
Across the region right now, Haitian President Jovenel Moïse has asked the Organization of American States for assistance to deal with the security crisis in the French-speaking Caribbean nation, days after the death of 4 police personnel in a botched raid. President Moïse asked for help on Monday when he met with OAS Secretary General Luis Almagro to discuss security. In a statement, they said during the exchange, the president asked the important organization for technical support to aid the National Police of Haiti. The discussions came on the same day that an extraordinary council of ministers met at the National Palace and adopted a decree to revise the state of emergency legislation to give the Superior Council of National Police the means to combat banditry and crime and to empower the police force and the armed forces to work in synergy to combat insecurity across the country. The efforts come on the heels of an incident on Friday in the capital where kidnapping victims are often kept. 4 cops were killed and 8 injured in an attempted raid on the gang stronghold. Jamaica on Monday received 14,400 doses of coronavirus vaccines through the COVAX facility, becoming the first country in the Caribbean to get their allocation through the COVAX initiatives. PAHO's revolving fund, which is responsible for the procurement of COVID-19 vaccines for the countries of the Americas under the COVAX facility, sent 14,400 doses of the Oxford AstraZeneca vaccine manufactured in South Korea. The arrival of the vaccines will serve to protect priority groups and the most at risk, such as health workers and older adults, the Jamaican government has said. Monday's delivery was part of the first phase of deliveries for Jamaica, and more vaccines are expected to arrive in the country throughout the year. The island is expected to continue receiving doses through May until it reaches 124,800 doses, the amount specified by COVAX. Other Caribbean nations are awaiting their turn to receive the vaccines through the COVAX initiative. And finally tonight, international news. The U.S. drug company Moderna has begun studying its COVID-19 vaccine in children aged 6 months to 11 years old, the company has announced. Moderna is the first U.S. manufacturer to test its vaccine on infants. The company plans to enroll some 6,750 children in the U.S. and Canada for the trial. The inoculation of children and young people is seen as critical to achieving the level of herd immunity necessary to halt the pandemic. While the risk of children becoming seriously ill from the virus is smaller than for adults, there is still a risk of transmission, especially among teenagers. Both Moderna and Pfizer began testing their COVID-19 vaccines on children aged 12 years and older last year. Results on those trials are pending. And that's your News Source Evening Bulletin for tonight. I'm Gordon Mosley reporting.